Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Rasulil Kareem. Wa ala alihi wa sahbihi ajma'een. Just going to do a brief talk. This is going to be an advice, basically an advice to the Imaams, the Du'at, the Tulaabul, as well as the new position in America, the resident scholar. This is an advice to those brothers in these particular fields or positions, if you will. This with regards to mental health. Things that you brothers can do to help you to be able to effectively deal with people no matter what their psychology is, no matter what their mental illness is, no matter what type of developmental disability that they may have. So one of the things that I want to touch on is that, alhamdulillah, Allah has blessed many of you brothers to get knowledge, to ascertain Islamic knowledge. Some of you are on higher levels than others, and that's fine. Some of you have degrees, some of you have ijazat, while others of you have both. Alhamdulillah, and that's good. Many of you studied in Saudi Arabia, some studied in Pakistan, some studied in Mauritania, some studied in Egypt. There are those who even studied in Morocco as well as Malaysia. And there are other places that others may have studied, even India as well, as far as those countries who, although the Muslims are a minority, they have a significant number or population of Muslims in those lands, such as I mentioned, India and Ethiopia. Some may argue, say Ethiopia has more Muslims, and Allah knows best. But the point of this brief reminder and talk is basically to encourage the brothers in these positions to get a better understanding of mental health. And one of the ways in which you can get a better understanding of mental health is simple things such as, number one, reading books on areas pertaining to mental illness, learning the different theories with regards to how to treat mental illness or how to deal with mental illness, things of this nature. There are many books out there. You could utilize textbooks. Sometimes college students resell their books. Well, I would say, why not buy those books from those former students in their area? And you can learn the basics of psychology and things of this nature. So books are a welcome addition. Number two, another thing that can be done is to utilize mental health professionals and or paraprofessionals, utilizing these people to help you within the community, right? For example, you have people who are psychiatrists or psychologists or licensed social workers, right? Clinical social workers, that is. You have family and marriage counselors. People with these type of credentials can be utilized with regards to helping you help the people within your respective communities. Now, also in utilizing these people, you can gain knowledge from them. You can ask basic questions. Okay, someone from the community has schizophrenia. How did they come up with that diagnosis? You have someone there who can tell you how that person was diagnosed, then on top of it, they can show you in a book. For example, they use the DSM-5, right? This is the standard. This is the Diagnostic Statistical Manual. This is something that is used by mental health professionals, no matter what type of letters they have behind their names. So these are people that you can utilize face to face. And if you have books, you can bring those books to those individuals to help give you a better understanding of people who have mental health or developmental disabilities. So these are the two major ways wherein you brothers can educate yourself on how to learn and deal with individuals within your respective communities who have mental illness. And also, you can utilize those people, if possible, to help you in dealing with or treating people within your respective communities. So these are two areas that I believe will be truly beneficial. Also, you can utilize paraprofessionals, people who they don't have high degrees. They may only have a bachelor's in psychology, right? Or they may only have a 2-year degree in human services technology. However, despite that, they have a working experience with mental illness. Why? Because they've studied it. Now, although they can't diagnose, they are fantastic in helping you to, I guess, be aware of what's going on with a particular person. And these people can also read journals that are written by those professionals and can give you some understanding and some clarity and can break down what theories are being used in their treatment. So paraprofessionals are great to use. People may work in a psychiatric ward or unit. You have people who work and operate group homes. You have people who are habilitation technicians, such as myself. That's one of the mental health fields that I do. Then you also have those who work in corrections, wherein you have to deal with the criminal mind, the criminal mindset, as well as mental illness or developmental disabilities. So utilizing these professionals and paraprofessionals is a fantastic way of learning more about mental health, whether it be mental disorders or whether it is developmental disorders, as I previously mentioned. Now, the third route that one can take, and I highly advise this, even if you yourself aren't going to be a person who strive to get degrees, right, in psychology or social work or any of these licensed family counselors, right? Let's say you're not going to strive to get a master's degree. That's fine. No problem with that. But my advice would be to take classes or go to a community college and major in paraprofessional curriculums. And some of those paraprofessional curriculums, they also have bachelor's, and some of them also have masters, such as the curriculum that I studied, and that is human services technology. When I first studied human services technology, it was a generalist. It was a generalist curriculum, and it was designed for these people, these individuals, to play a support role to the professionals. You were taught counseling. You were taught the different counseling theories. You were taught interviewing techniques. You also obtained a diploma in nursing assistance because you may find yourself working in a nursing home because you can work in gerontology. You can also work in a mental hospital or psychiatric units. So therefore, having the nursing assistant certification was detrimental and huge with regards to this curriculum. So you will get that as well, where you will learn medical terminology. You will learn how to do those things wherein you can assist nurses, such as how to make a bed with the patient on the bed, things of this nature, how to properly clean an individual with a catheter. So these are some things wherein you could take the human services technology curriculum. Now, you may say, well, I don't want to get a 2-year degree in that. And that's fine. The beautiful thing about this is that you could actually get a certification or you could get a diploma in it. The certification, I think, it's like 6 months, wherein the diploma is like 1 year. And the reason I'm mentioning this because this will play a tremendous role in assisting you brothers in these positions. You will know what a schizophrenic is. You will know the different types of schizophrenia. For example, you will know what a catatonic schizophrenic does, what actions they exhibit. One of the things that they can do is they can stand in place, stand in one position for hours. Like, for example, with their arms outstretched, they can stand for hours with their arm outstretched. Normally, your mind will tell you, look, there's too much blood flow draining into the arms, wherein you have to put your arms down. Not only does the brain tell you that, it sends signals. Now we're talking about neurology now. It sends signals to the rest of the body, bring those arms down. Even though you're making a conscientious effort to keep your arms up, your body like, nah, bring them down. Because you don't have enough sense to realize that you're causing harm to your own body. So we're going to bring your arms down for you, right? Things of this nature. This will help you understand what goes on in the mind of a person and their behavior, the different types of diagnoses. You will also learn the different axes with regards to the DSM-5 now. When I first went to school, the DSM-3, it was on its way out, and the DSM-4 came on the scene. So now we have what they call the DSM-5, right? And you can learn about the different axes, and you can learn how these professionals diagnose. Now, you may yourself might not be able to diagnose, but you can at least understand and respect how these individuals with the masters and PhD, how they arrived at the conclusions that they arrived at by looking at the axes. You understand? So this will help you with regards to dealing with people in the community. Another area that this will be beneficial is that it will teach you counseling techniques, wherein a person may need some counseling. And many cases, you brothers find yourself in a situation where you have to do counseling. And unfortunately, many of you don't have the necessary skills in counseling, right? For example, when you're counseling, do you paraphrase back what the person is saying to you? To make sure you heard everything properly, make sure you received the information properly, and 2, to also show or inform to the person who's doing the talking that you're listening, right? Because unfortunately, sometimes we have a propensity to show that we're really not listening. And so that kind of disheartens the individual who opened up in the first place. They may say, hey, he doesn't even listen. I don't even think he even knows how to listen. You understand? So taking these curriculums is a good way of learning how to paraphrase what someone says to you, how to ask open and closed-ended questions. Also, how to do perception checking. Find out when a person says they feel a certain way about something, then try to ascertain what was the feeling when said thing was done. You understand what I'm saying? Counseling teaches you these things. You understand me? So this will be a terrific tool in helping you brothers in the various masajid and Islamic centers throughout America. And this can also apply to our brothers in the UK, Canada, France, and the likes, whoever may get this video. Now, another course, this is something fairly new, and that is support specialist, right? This course normally takes about 2 weeks and you're certified. And one of the things that you do is that you basically deal with people who suffer from addiction, right? And human services is excellent in dealing with addiction. And as I mentioned before, when I took it, there was only one type of human service. That was it. One type of human services, technology. But later on, there was the human services technology. It was like the generalist. Then there was the human services technology mental health. And then there was the human services technology addiction or substance abuse, right? And this delved into the different types of substance abuse and addictive behavior, addictive personality, and addiction. What is addiction? And its various types. It doesn't necessarily have to be drugs or anything like that. You know, as we know, that addiction can come with anything, you know, porn or whatever. People can become addicted due to having an addictive personality. And the Human Services Technology program is very good at teaching these areas, and among other things like gerontology, developmental psychology, the study of life from conception until death, things of this nature, and the various theories that come along with that, crisis intervention. Beautiful curriculum. And now you could get a bachelor's in human services. But the support specialist is different. This is something fairly new. Here in North Carolina, you will go through UNC to take this particular certification. And they have quite a few jobs in this field. Support specialist. It's in the Department of Social Work. And Allah knows best. But it may in the future, because it seems like it's making great strides, it may in the future become in and of itself its own discipline, just like human services. Human services technology in and of itself became its own discipline, but it drew from psychology. It drew from biology. It drew from counseling. It drew from those areas and became its own discipline. There's something else, it slips my mind, but it was like 4 disciplines that it drew from. So this is my advice. Take classes, utilize professionals and paraprofessionals in your area that's in your community, and or read books, read articles. This will greatly enhance your understanding of mental health issues, mental illness, and or developmental disabilities along with addictive behavior. This is my advice to many of you brothers. This is in the realm of seeking knowledge. We know the famous hadith of when Rasulullah sallallahu alaihi wasallam, he sent Mu'adh ibn Jabal to Yemen, radiyallahu anhu, and he informed him that he was going to the people of the book. Until the end of the hadith, so that the first thing you call them to, La ilaha illallah, if they accept it from you, then they have khamsa salawat, 5 daily prayers in the day, to the end of the hadith. We know this. But the point in me mentioning this hadith is that very first part. And that is the fact that Rasulullah sallallahu alaihi wasallam informed the Sahaba that they were going to be going to the people of the book. Because, and I say the Sahaba, because it's Mu'adh, but he also sent Abu Musa al-Ash'ari, we find in other narrations, as well as Ali ibn Abi Talib, radiyallahu anhum. However, the focus is the hadith dealing with Mu'adh, radiyallahu anhu. So, Rasulullah alayhi salatu salam sent Mu'adh, and he informed him of the reality of the type of people he's going to be dealing with once he got to Yemen, right? This is a reality. So Sheikh Uthaymeen, his provisions of the caller, he said, and this, talking about this part of the hadith, he said, this is proof that the caller must know who he's calling, or he must know the reality of the people who he is calling. And here in America, we have a melting pot of people from all over the place. For example, from amongst the people, the Muslims in America, are those who are African American. The African Americans, for the most part, as a whole, are traumatized people due to their history and due to their present history, right? With the discrimination and the racism that they experience, which has caused all types of psychological and physical harm. Like, for example, now we're dealing with COVID, right? COVID-19. One of the reasons that COVID-19 has hit the African Americans the hardest, along with the Native Americans and then the Latinos, is because these three groups of people have been oppressed. And on top of that, the systemic issues of not being able to live in the type of housing others can live, not being able to access the same health care as others are able to access. These things play a role in what? The medical health of the people as a whole. So therefore, when COVID hits, of course, the people who suffer the most medically, they're going to get hit the most because they suffer the most ailments due to the systemic issues, right? Also, and this is just with regards to the African American. That's just one group. Now, we haven't gotten into the Muslims from the Native American community or those Muslims who are a mixture of both. And then the Latino community, right? Who in many cases suffer from some of the same historical problems that the African Americans and the Native Americans suffer from. When you delve into history with the slave trade from the Caribbean back to the mainland, all this whole landmass America. So there was some back and forth between the Caribbean and the mainland of America. So you have to know this, and you have to know the impact that this history might have had on the psyche of the people. Another thing that is a reality that sometimes we have the propensity to forget, and that is that many of our Muslim brothers and sisters come to America from war-torn or war-ravaged lands, or they themselves were persecuted and they were on the run. So they ended up in America. Like, for example, like our Palestinian brothers and sisters. They suffered trauma. Many of them who are directly from Palestine, who are here now, they suffer from trauma based on what they went through. They may need some mental health counseling. They may need any type of treatment. Or they just need someone to sit down, hear them out, and listen to them. That's where you come in. Or whether you're talking about the Somalis, or whether you're talking about our brothers and sisters from Bosnia and Herzegovina, or Kosovo, right? The Albanian brothers and sisters who were from Kosovo, right? Who were brought here. And recently, the Syrians and the Rohingya, right? Many of these people, Afghani brothers and sisters, many of these people may need counseling, which is more short term, or they may need therapy, right? So who better to give them this counseling and this therapy than who? Than us. So these are areas we need to tighten up on. Areas we need to tighten up on. You know, from amongst not just the students of knowledge, but the lay Muslims, but more so the students of knowledge, because they have to be able to deal with the people. They have to be able to deal with the people, and they have to be able to understand those people and their realities, right? So, with that being said, lastly, I would like to get into the types of professionals, because many times we have the propensity to get thrown off with the names or the letters behind the names. So we're going to delve into that. And I'm using this book, Are You Okay? By Katie Morton. She is a licensed family and marriage counselor. So she the one who put this book together. And she also has a huge YouTube channel. So I would encourage people who dealing with mental health. She's one of the ones who you can go to her YouTube channel and check her out. But anyway, so let's look at some of the different types of people. Let's start with the psychiatrists, right? So the psychiatrists, they're medical doctors. They're medical doctors. What happens is they went to school for 4 years. They might have majored in psychology or something, and then they went to medical school after that, right? And then they did the residency, and then they focused on mental health and psychotropic drugs and things of this nature. So this makes them a psychiatrist. So basically, these medical doctors or these psychiatrists, they're basically psychologists who can basically issue drugs, basically. Out of all the mental health professionals, they are the only one who can prescribe drugs, right? Psychotropic, things of this nature. And of course, you know, we got issues of nurse practitioners and physician assistants, right, that may work in that field, also who could possibly do the same thing, like the psychiatric nurse, right? This is a nurse basically who went on to get their master's in psychiatric nursing, right? Or it's a nurse who they don't even have a master's, they might just have a 2-year degree. But they work in a psychiatric unit. So they become familiar with not only the behavior of people diagnosed with certain mental illnesses, but they also become well versed in the types of drugs that are used. You know, whether those drugs enhance neurotransmitters such as dopamine or serotonin and the likes, right? They will have knowledge of that because of working firsthand, right? And their understanding of medical terminology. So that's 2. Just gave you 2. The psychiatrist and the psychiatric nurse. Now the psychologist is basically a person who has a doctorate, right? Well, first of all, you don't have to have a doctorate. Psychologists can have a master's. You're never considered a psychologist until you have a master's degree, right? This is the psychologist. And what happens is you may find a psychologist who has PhD behind their name, right? Or they may have the PhD is the doctorate of psychology. I'm sorry, the doctorate of philosophy, PhD. Or they may have the PSYD. That's a doctorate in psychology, right? And so one delves into philosophy. They got basically they got their doctorate in philosophy. That's a lot of philosophy in psychology because of the theories, right? Whether you're talking about Freud, Sigmund Freud, psychoanalyst theory, right? Or whether you're talking about Aaron Beck, right? Cognitive. And also those who do cognitive behavioral, Albert Ellis, right? You have so many different ones. Mickenbaum, a person who you think, whatever you think, that's who you are. Or you have the social cultural theorists like Thomas Saz, like this. And then that's just from the psychological standpoint. We haven't even gotten to the social. That's just dealing in, the theories individually. We haven't even gotten to the social theories that many of these psychologists come up with, whether you're talking about critical race theory, whether you agree or disagree, or whether you're talking about social dominance theory, right? Things of this nature. So, at any rate, these individuals, they have a PhD or a PsyD. I like to call it PsyD, capital P, S-Y, capital D, Doctorate of Psychology. So that is the third group, the psychologists. And they're going to either have a master's, or they're going to have a doctorate in philosophy, or they're going to have a doctorate in psychology. The next person is what they call the psychiatric mental health advanced practice registered nurse. This is what I mentioned. This was the second one. Now, this type of nurse here, what's going to happen is you're going to see PMH-APRN behind their name, right? That last part, it shows that they're registered nurses, right? Practice registered nurses, right? Because they practice what it is that they're doing. Remember I was telling you a while ago about the person who they don't have a master's, they might can't diagnose, but they're practice registered nurses. Meaning due to their practice and being registered and their experience, then they have knowledge. And you can utilize these type of people if you have one of them in your community, right? PMH, as we mentioned, mental health advanced. This person 9 times out of 10 got a master's degree. Like they specialize in mental health, right? Like this. The licensed marriage and family therapist. This is the LMFT. And this person has a master's degree for the most part. They probably have a master's in clinical psychology like this. And then they learn how to counsel marriages and family issues. This is what they focus on. So you'll see the LMFT, licensed marriage family therapist, right? The next is what they call a licensed clinical social worker, right? Licensed clinical social worker. Now, everybody I just mentioned can diagnose. Everybody I just mentioned can diagnose except the nurse unless she has higher degrees. However, or he, I shouldn't say she, he or she, you have male nurses too. However, don't get it twisted. The nurse who can't diagnose, don't get it twisted. They have knowledge, and they have practical knowledge. And so you need to listen to them. If they're talking about a particular disorder, listen to them. Take advantage of them. But the licensed clinical social worker, this is the LCSW. LCSW. Right? So they do an undergraduate study in psychology or social work program. But what happens is they go to get their master's in clinical social work. And it's not uncommon when you find the clinical social worker and the clinical psychologist together. It's not uncommon. And they both diagnose. And they both do therapy. They both are licensed. So, again, if you have a licensed social worker, a licensed clinical social worker, licensed clinical social worker in your community, take advantage of it. And behind their name will be LCSW, licensed clinical social worker. And next is the licensed professional counselor. Licensed professional clinical counselor, LPCC. LPCC. Licensed professional clinical counselor. Now these guys and girls right here, they basically the newest addition to this field, to the mental health professional. They basically new. And they don't exist everywhere. They don't exist everywhere. But you'll find them in states like California. I'm not sure if we have them here in North Carolina. We may. I don't know. Allah knows best. But if you have them in your locale, utilize them. And so she goes on to say, talking about this particular group, she said, just as you may have suspected, LPCCs, right? Licensed professional clinical counselors, had to complete pretty much the same requirements as LCSWs. That is, licensed clinical social workers, and LMFTs, like she is. That's licensed family marriage therapists. Right? They have to do the same thing. They have to get a master's degree, basically in professional clinical counseling. So basically clinical counselors, right? And some of these guys can be clinical psychologists, but I think there's a specific thing for them. You know, they learn various therapeutic techniques and how to apply them, as well as how to accurately assess a patient. They can work with people who are adjusting to a disability, who want to focus on their personal growth, or who are managing a crisis. LPCCs cannot prescribe medicine. They can't prescribe medicine. Right? Cannot prescribe medication. But they can help you with any other emotional issue you may be struggling with. Right? So overall, the LPCCs tend to take the broadest approach to helping their patients. They do not merely focus on relationships or ways to better navigate our environment, but instead look at our struggle more generally. And that's those people. Then you have what we call the LEP. That is the Licensed Educational Psychologist. LEP. Right? These guys, of course, 4-year college. And then they have a master's degree or higher. Then, you know, of course, they have to work in the school system or work in education for at least 3 years. They must pass their licensing exam, right? Like some of your guidance counselors may be from this group, right? Remember the guidance counselors in school when we went? Well, this group right here. LEP, Licensed Educational psychologists. So these are some of the fields of professional mental health professionals that you can utilize. And as I mentioned, I can't state it enough. If I said it 1,000 times, this will be 1,001. If you have any of these people that I just mentioned in your communities, wherever you go, whatever masjid you go to, whatever city, state, town, whatever, utilize them. Utilize them, and utilize them to help you to better serve your communities. Ask them questions. There's no difference when you are asked questions by them about the rulings on certain things, right? It's no different. So, likewise, utilize them to help you deal with situations in your communities. You have a licensed marriage family therapist. Then when you go to deal with marital issues, have these people on deck to help and deal with this. Right? And this is what I want to present to our brothers who are Imaams, Tulaabul, or, like I said, the new position now, resident scholar, and the mudir, right? All of these people. And this also applies to the board. And if you individuals who are on the board, if you're on the masjid board or the majlis, ashura, if you are from one of those professions that I just mentioned, whether professional or paraprofessional, then you need to assist the imam in helping with the mental health of your communities. And this is what I had to present. Whatever is correct is from Allah subhanahu wa ta'ala. And then whatever is incorrect, no doubt, it comes from me and the shaitan. Make no mistake about that one. So with that, I end. Subhanakallahumma wa bihamdik. Ashhadu an la ilaha illa ant. Astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh.